When it's time to get help caring for your loved one with dementia, you need to know where to turn. Family and friends are a great place to start. They can give you a much-needed break, but you might need more than that. Here are some resources that can help you find the assistance you need. National Alzheimer's Association. Their web address is www.alz.org, and you can call their 24-hour helpline anytime, day or night, at 1-800-272-3900. Elder Care Locator at www.eldercare.gov, or call the toll-free number at 1-800-677-1116. Administration on Aging can be found online at www.aoa.gov. The Family Caregiver Alliance is at www.familycaregiver.org. Your church or local community center may have some resources available to you, so please ask. Support groups are a great place to get ideas and references for caregiving assistance. There are several types of caregiving assistance available. If you aren't sure what type of assistance you and your loved one need, talk to a social worker, your doctor, or a nurse. Here are some of the options. A companion or assistant. This person has little or no medical training but can assist with housework, errands, or sitting with your loved one. Respite worker. He or she comes into the home to provide personal assistance that includes toileting, bathing, dressing, exercise, and errands. Adult daycare centers. These are places you can drop your loved one off for the day or just a few hours. It's important to ask if there is a nurse on staff to administer any medications your loved one may need. Certified nurses' assistants have medical training and can give excellent in-home assistance. CNAs can work on a part-time, full-time, or live-in basis. Live-in assisted facilities. If your loved one can no longer live at home but is still somewhat independent, he may do well in assisted living where health aides and medical professionals are on staff. Nursing homes are primarily for patients who need round-the-clock care. Besides hiring qualified, trustworthy people, one of the chief concerns of engaging a caregiving assistant is how to pay for it. Here are some basic guidelines. VA benefits. If your loved one served in the military, you may qualify for veterans benefits to cover the costs of a caregiving assistant. Medicare. It may pay for some in-home health care. Check with a social worker to find out what your loved one qualifies for. Medigap is additional insurance that could cover costs that Medicare doesn't. Long-term care insurance. It helps you pay for expenses related to chronic illnesses like Alzheimer's disease. It may pay for in-home care, assisted living, and nursing home care. It may be necessary to tap into assets such as retirement funds, stocks, bonds, or property. Medicaid may pay for some services if an estate is nearly depleted of resources. It is not uncommon for family members to chip in to help pay for caregiving services, especially if they can't be there to help personally. Community services at low or sliding scale fees that include transportation, meals, respite care, and support groups may be available in your area. Call your local Alzheimer's Association to find out details. For more information about caregiving assistance, talk to your healthcare professional.